Should I take the mini pill while breastfeeding? The bottom line up front is no. Stick around and I'll tell you why. It's very common for women to avoid using certain types of birth control because they believe it will affect their ability to breastfeed the baby. In particular, women will avoid combined oral contraceptives, which contain both estrogen and a progesterone. Instead, many women are prescribed the so-called mini pill while breastfeeding, which contains just a progestogen. Some women even avoid other methods of progesterone-only birth control like the IUDs or the Nexplanon with the thought that any form of hormonal birth control will negatively impact them while breastfeeding. But there was never any science behind these ideas. Despite this, it's far too common that lactation consultants will blame a woman's birth control for breastfeeding difficulties, and this perpetuates the myth that birth control negatively impacts breastfeeding. Moms and lactation consultants will often misinterpret anecdotal evidence. If a woman has difficulty with breastfeeding after her 6 weeks postpartum visit, she might blame the initiation of whatever birth control the mom's just started rather than more obvious causes, like the baby now sleeps through the night and feeds less during that time period, or the mom returns to work and introduces nipple confusion and breast pumps and things like that into her daily routine, which cause problems. A 2019 study found that only 79% of physicians considered oral contraceptives with estrogen compatible with breastfeeding. But among non-physician healthcare providers, the numbers dropped down to a low of 55% among nurses. This shows we still have a lot of work to do to push back on this old myth. In 2010, a review by the Cochrane Collaboration found that there was just no scientific evidence that hormonal birth control negatively impacted breastfeeding. They looked at decades worth of studies that had been done at least up until that point. The existing studies were all of very poor quality and disagreed with one another usually. The authors called for randomized and appropriately controlled trials to determine more definitively if there was any impact of hormonal birth control on breastfeeding success. Part of the confusion about the effect of hormones and birth control on breastfeeding in the older studies that perpetuated this myth had to do with when the birth control was started. It probably is the case that starting hormonal birth control immediately after birth can have an impact that's negative on the initiation of breastfeeding. But nowadays, in order to reduce the risk of blood clots, we don't usually start birth control with estrogen in it until 6 weeks postpartum anyway. So that just doesn't apply. We don't recommend starting birth control with systemic hormones until breastfeeding is well established. Several good studies have been done since 2010. For example, a 2013 study found no difference in the amount of infant milk intake, rates of breastfeeding, continuation of breastfeeding, or infant growth when women who used a combined oral contraceptive pill, a progestin IUD, or the progestin implant were compared to women who just used the copper IUD. A 2016 review of dozens of articles looking at the effect of progesterone-only birth control on breastfeeding found that there's just no impact at all. This includes the mini pill as well as things like the progestogen IUDs and the Nexplanon. A similar 2016 review of 15 studies looking at the effects of combined oral contraceptives with estrogen on breastfeeding found no impact on any breastfeeding outcomes as long as the pills were not started until at least 6 weeks postpartum. So why not use the mini pill? Well, it simply isn't that effective. When combined with exclusive breastfeeding, the pregnancy rate is very low, but that's partially because the breastfeeding itself is providing some birth control benefit. At some point, though, women will resume ovulation while they continue to breastfeed, and when that happens, they usually don't know it. Then the mini pills will be less effective than normal combined oral contraceptive pills with estrogen, which themselves still have a failure rate of 8.4% per year. On the other hand, birth control like the IUDs and the Nexplanon have no impact on breastfeeding, on blood clots, and they have a failure rate of less than 1 in 1,000. In other words, there's no reason to use the least effective method of prescribed birth control because of a mythical and non-scientific concern about how other forms of birth control will impact breastfeeding.